The most exciting time of our lives is that day when we bring new life into the world. But childbirth doesn't always go as planned, and when baby has to separate from mom to receive special care, it can be gut-wrenching.
When he was born, I noticed that he wasn't crying. And I could tell my husband, he's not crying, he's not crying. Then one of the nurses said we have to take him just to check him because he seems a little bit blue. They came in and they told us that the baby's not doing very well, that he might not make it. And my husband just walked out of the room crying.
Baby Ayan was 5 weeks premature and struggling for his life. The doctors, nurses, and staff worked furiously to stabilize him. But Lodi Memorial does not have the neonatal intensive care unit needed to treat an infant that premature. Like other premature babies, little Ayan was airlifted to UC Davis for special treatment in hopes of saving his life.
And I wasn't supposed to get out of the hospital that day, but I begged them to let me go with my, to be with the baby. I received 2 calls from the hospital saying that he wasn't going to make it again. And me being at the hospital away from him, it just felt terrible, like not being able to do anything, but not being there either.
Jamie Weldon's little boy Levi was also too premature to be treated at Lodi Memorial.
He was struggling to breathe, and so they were having to do that for him, but they didn't have the proper equipment at Lodi Memorial to care for him. They did their best. It was heart-wrenching, it was scary. I felt helpless.
We at Lodi Memorial are continually recognized for our excellence of care. A Level II neonatal intensive care unit would allow us to treat babies like Ayan and Levi who are up to 5 weeks premature, caring for them right here alongside their mothers.
5 minutes after delivery, we want to get that mom and baby skin to skin. So that's really the first hour after life is bonding time that you can never get back. And you want to continue doing that, but if the mom is separated, it's difficult, obviously, to do that. For my staff, they want a Level II because they too want what's best for moms and babies.
These are the most vulnerable and the smallest of our patients. So we really want to keep those babies with their moms and provide that extra level of care that is needed for these babies.
A Level II neonatal intensive care unit is the next step in Lodi Memorial's efforts to provide excellent care for this community. This is Levi today. He just turned 3 years old.
It's very important, I feel, that every hospital has some sort of NICU facility so families don't have to go through that traumatic experience because, first you're thinking, well, something's wrong with your child and then now we're going to take it from you. It was traumatic. It really was.
The reality is babies are miracles. When you have a perfect delivery and a perfect baby, it is truly a miracle.
And as for baby Ayan, well, he's doing just fine. A miracle indeed, and one we here at Lodi Memorial would like to see more often.